Good evening and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, can this little bottle, just right here in my hands right now, the end of COVID-19 for India and the world? Well, what is this? This is simply what a nasal vaccine will look like. What is a nasal vaccine and why is it said to be such a massive game changer, not just in India, but across the world? Let's dive into this explainer as I take you through why and how will be all our lives going to change once the nasal vaccine is out. As India waits for more vaccine approvals to take place, is there a game changer just around the corner? Well, several experts and now even Niti Aayog believes that the big game changer India and the world is waiting for is what's called a nasal vaccine. What is a nasal vaccine? Well, it is called a vaccine, but essentially it's a dose given via the nose rather than through a needle in your arm. As the target is to deliver a dose directly in the respiratory pathways, it is like a nasal spray. And with that comes the game changer, reason number one. Since it's non-invasive, no needles required, it does not need healthcare workers to administer. So how does it work? Well, it is a live initiated vaccine, meaning it uses the weakened form of the germ. When you give it through the nose, there is a mucous membrane in the upper throat where it gets absorbed and it will then be able to develop antibodies. Since it enters the mucous membrane directly, the absorption is much faster. And since the immune response in the nose, which is the point of entry of the virus, comes in, there lies the game changer number two. It is only not going to build immunity, it will give you protection from the virus, prevents the spread, and this is something, remember, a regular vaccine simply cannot do. So how effective is it and how soon can we expect one? Well, at the moment, there are about 4 vaccines that are undergoing phase 1 and phase 2 trials, but that's across the world. The good news here is that Bharat Biotech is also working on one of them and has actually applied for approval for phase 1 trials here in the country. One is with the US-based vaccine maker FluGen and the other is with the University of Washington School of Medicine. Now, the vaccine has demonstrated protective efficacy in mice and hamsters so far. Mice and hamsters showed immunity with its single dose and in fact gave superior protection, much more than what 1 or 2 doses of the intramuscular vaccine achieved. And there lies our game changer number 3. Only 1 dose is enough. You can achieve immunity and you can immunize a larger number of people in small amount of time, and that there would be no need for people to come back for a second dose. And that's not it. Only 0.1 ml is required. That is simply going to be spread or put in with a spray in each of your nostrils. Now remember, several doctors have said that once global herd immunity is achieved, COVID will be reduced to just say a common cold. Well, this simple spray will be able to achieve abundance that can be popped in a small bottle like the one you get in your nasal sprays, and that is good news for India and the world. Sonal Mehrotra Kapoor, NDTV. Now, we spoke about this to Bharat Biotech, who have already approached the drugs controller to try and understand and get rolling in the phase 1. And they also issued a statement saying that based on the preclinical animal safety data, we have applied for permission for the nasal vaccine to DCGI. And upon receiving official permission for phase 1 trials expected to start soon in February. Now, we will be in the forefront of innovation using cutting-edge technology platforms and product development for COVID vaccines and other viral vaccines in the years to come. So we are confident, Bharat Biotech says, to take forward new vaccine delivery models through intranasal route for enabling quick and easy administration of the vaccine. Now, so there is no data done on humans just yet, but we thought let's get experts from across the world to give you a sense of how exactly a game changer this is going to be. And we've got for you everybody's favorite doctor. Joining us on the program today is Dr. Fahim Yunus, somebody whose tweets you've seen all the time, and all of us love taking a look at his anecdotes and sort of the analogy he puts forward, making medicine so accessible and so easy to understand for the world. Thank you so much for joining us, Dr. Yunus. I want to start by asking you, How big a game changer do you think it's going to be, considering that the great news at the moment is the results we have on the nasal vaccine on mice and hamsters, but still no data available, say, on human efficacy?
It's a good development. I hesitate to use words like game changer because we don't know. When the time will come, we will have that open excitement. Today it's time for guarded excitement. And why I believe it's a good intervention, because we have seen that these nasal vaccines provide immunity at the point where it's needed. So if you want to understand it very simply, when you leave house, you want to close the front door because that's where somebody's going to come in from. That's how somebody's going to break into your house. You don't lock every door in your house, every room. So regular vaccine essentially provides immunity to the whole body. Nasal vaccine provides immunity to exactly that mucosal surfaces where the virus is going to enter, like the front door. The advantages are that it's very easy to administer, may not require a cold chain, may not even require a nurse or a needle stick. You can just squirt it in the nose and it provides you good immunity. The problems are we don't know the efficacy so far.
Right.
It's a long way out. The phase 1 trials have just started. It has been tested in animals. But I think why I'm excited, why I think it's a good news, because we're going to have to need multiple vaccines to have access, to give access to everyone in the world. And this particular vaccine has potential for children. And remember, all of us want the schools to be open. So I see that niche market, particularly in the developing world, really benefiting from it.
Right. And, you know, while I like you saying it should be guarded enthusiasm when it comes to it, but the excitement here really is that you can really be putting the vaccine in your pocket and that's good to go. That's how simple it will get to be. But, you know, studying the tech behind nasal vaccines while I was researching for this, I found it extremely fascinating, the potential it has to build immunity. And you mentioned that children as well. Do you think, what in your view will there be into not just both infection being protected and the spread as well?
Sure, regular vaccine, you have multiple kinds of immunity. Immune system is complex, but to simplify, there's an IgG kind of antibody that protects us in the blood, and then there's an IgA sort of antibody, which is the front door lock, which is just mucosal. That antibody is secreted in my nose, in my throat, not necessarily in my blood. So these mucosal vaccines that are given in the nose, or even for polio, for example. Polio spreads fecal-oral, meaning we ingest it. And that is why you've seen those WHO pictures, people giving polio drops. What is that? Those drops then go exactly where the virus goes and act locally. Similarly, this coronavirus goes through our nose and nasopharynx. So giving the virus, the vaccine exactly at the same location may produce more IgA antibody, may reduce the risk of infection, and may also reduce the risk of transmitting the disease for those who have been vaccinated.
And how do you think it will play out in countries like India and across the world, really? Because this is the large, the large population is the big challenge here. Also curious to know about, you mentioned kids. Can this be used on kids?
Absolutely. For developing countries, all you need is a willing volunteer, and vaccination drives have shown us the big difference between treatment and vaccine. You have to take the vaccine to where the people are. That's when they work best. You can imagine just some volunteer taking 5,000 shots to a school and in one day being able to give these nasal squirts to 5,000 children. That's the potential we have with this, which we will not have with Pfizer or Moderna that require ultra cold storage.
So certainly can be used in schools as well. Of course, my last question to you, how realistically do you think, how long will it take for us to get to a point where nasal vaccines can be made available to the world?
This is where you're not going to like it, but the reality is this is where the uncertainty is, and we cannot overpromise. That's how science works. This pandemic has just projected things out in the public that remained in scientific journals for years. I can't project a timeline on it. The best timeline right now that I've been reading about is 6 to 12 months. Some people may think that's too late. I think that's not too late. Even if it comes at the tail end of 2021, we are still well within that next school year. This pandemic as it stands, in my view, is not going away globally. In some countries, yes, Taiwan, New Zealand, they don't have the pandemic even today. More countries will join that list, but I don't see it completely going away in 2021. So I think, and another larger picture here is this is not the only additional vaccine. You're going to have Johnson & Johnson. You're going to have many other vaccines coming in the market. And ultimately, it'll be great to have multiple options for people in the developing world, developed world, and we all win this pandemic together. Otherwise, there's no point. Like right now, I'm vaccinated here in US, but I don't feel safe because everybody around me is not vaccinated. We all win when we win together.
All right, Dr. Yunus, thank you so much for joining us on FYI. Always love listening to your anecdotes and keep on those Twitter feeds coming in for all of us as well. Thanks for joining us on NDTV. All right, with that, we're going to slip into a break. On the other side, we've got more news for you, this time from the world of stock markets. And what exactly does the new market cap putting India as the 7th largest Sensex or 7th largest stock exchange market in the world mean? We'll be joined by experts as well. Come right back for that. Welcome back. Now a record closing for both the Sensex and Nifty, taking the Indian markets to the 7th largest in the world with a market cap of $2.69 trillion. In fact, it may soon take over France as well, whose market cap is a close $2.86 trillion. But let's put out the list for you to tell you how it really is looking like. US at $44 trillion, China at $11 trillion, Hong Kong $7 trillion, Japan 6.8, UK 3.2, France 2.8, India very close there at 2.6. Now, all this is happening in the backdrop of Sensex surging a whopping 11.31% in 6 straight sessions since the budget. In fact, the budget day itself, market jumped up about 2,000 points. And this is the maximum budget day increase in some 10 years or so. So what's really driving the market sentiments? And importantly, what does this market cap ranking tell us? Now, we have two brilliant economic minds to take us through that. We have Professor Apurva Javadekar. He is PhD economics from Boston University and former research director at the CAFREL at the Reserve Bank of India. Also, Sanchita Mukherjee, senior financial services professional. Let me begin with Professor Apurva Javadekar there. First up, just tell us, Apurva, for our viewers, how significant is this ranking? And what does it tell us about the Indian economy and the stock market at the moment?
Thank you. Thank you for having me on your show. So basically, what it really means is that India is a large economy and correspondingly our stock markets are also getting larger. But basically, does it tell us about the underlying growth in the economy? So at least it tells us that investors are expecting India to grow from here on. Otherwise, these valuations are not going to be justified. So as you rightly mentioned, 2,000-point rise after the budget just suggests that investors are very euphoric, and both domestic investors as well as international investors very euphoric about the new reforms announced by the government or the new budget direction that the government announced, which is more pro-capex, pro-capital expenditure rather than welfare. And that is, I think, investors think, and which is most of the economics evidence also would tell you that that is the right direction to take the country into a high growth trajectory. So I think current valuations are just reflecting investors' euphoria. But I think there are a couple other things one would want to look at. Right. Is that valuations can flip. They can, for example, after COVID, they flipped by 30%, 40%, and then they are now we are at a new high of the Sensex and Nifty.
You're doing better than pre-COVID times, actually, on the stock market.
Yes, exactly. So what actually matters is whether your companies, firms, corporations in the country are productive. Are good companies getting banking capital, and are they investing enough in R&D? That's going to sustain the long-term growth. And those are some of the important aspects to look for, because if you look at around the emerging markets, India stands as one of the most expensive market right now, with the trailing PE of roughly 38, which is one of the highest in the pack. And so to justify that kind of valuation, the earnings of the companies need to grow, and that's going to grow only when they are in the long term.
Right.
Only they're going to invest enough in the capital and their R&D and so on and so forth, and banking sector support them. So
right, and talking about the performance of the Indian companies, let's have that graphic up as well, which talks about the top 10 companies actually contributing to these figures. You've got Reliance Industries there, Tata Consultancy, HDFC Bank, Infosys. But if you look at the entire data of top 10, 6 of them actually from the banking sector. That's also a story worth telling. Let me bring in Sanchita on that one.
Yes, thank you so much for giving me this opportunity to being on the show. When we're talking about the market cap to GDP, I would like to address that point first. There are two aspects to it. I would like to explain it with two aspects, covering all possibilities of this show. So what is a market cap and what is the GDP? When we are talking about the market cap is to GDP being one of the 7th ranking, it does come across that we are very expensive, valuations are expensive, but I disagree on this front. And why? Because in real terms, our market cap to GDP would be somewhere very close to 80%, right? And why would I say that? This comes at a time when there has been a pronounced GDP contraction, pre-COVID, right? We had entered a slowdown, then we took the pandemic right on the chin.
Right, and as you speak, let's get that GDP graphic also for our viewers to just make sense of what Sanchita is actually saying. Yeah, go ahead, please.
Yes, so we took a GDP outlier. We went into a technical recession for 2 quarters in which GDP was negative, right? So the market cap to GDP was always pronounced. Now that the GDP outlook has improved considerably, right? If you see the IMF forecasting, World Bank, RBI forecasting, Goldman Sachs, JP Morgan, all of the forecasts, World Bank, etc. for India, including the credit rating agencies, the GDP growth, if the denominator were to increase, then your market cap to GDP obviously normalizes to a more acceptable level of 80%. That's point number one. Then we talk about market capitalization, right? If you're telling me that the stock market has surged ahead, right, and say there's a company which is at a 30x valuation. Now this 30x valuation has been derived out of absolutely dismal corporate profitability and earnings numbers. Right? Because we had already entered a slowdown even pre-COVID. So if you're attaching a multiple of 30x in absolute dismal conditions and with an economic outlook which has vastly improved now.
Yeah, so where is it coming from?
Right? So if your multiple were to trade at 40x with a 2 crore profitability, that 30 crore market cap increases to an 80 crore market capitalization. That is the multiplier effect. So with a multiplier effect, your market cap to GDP is still very averagely valued and poised to do much better going forward. It would normalize at 100 going forward. If the earnings were to keep up with the earnings growth that we have been now witnessing last 2 quarters. I mean, the GST tax collection, the earning numbers that are coming out quarter on quarter now indicates this market cap to GDP will improve. Now, the third point that I would like to stress on, which we need to understand in context to this market cap to GDP ratio, is the debt to GDP ratio. If we are to compare the debt to GDP ratio, India actually stands one of the lowest amongst all of these parameters of all of these countries.
Right.
Which indicates that our growth...
And we've got that figure on the screen as well for people to take a sort of comparative figure on how India stands compared to the world in terms of debt versus the GDP, yeah.
Yes, this is very important because look at the debt to GDP ratio, say for example, Japan, Canada, US, UK, Italy, all of them. So if I say today that US looks expensive to me vis-a-vis India, I would be right in assuming so because the debt to GDP ratio in US has been fueled by a lot of borrowing and balance sheet expansion which has been manifold.
Right.
In India, the growth is being fueled by the domestic consumption.
Correct.
And the fact that we do have a demographic dividend, which is consuming. And it is fueled by that. That is the expectation of the GDP growth and the improved outlook on corporate profitability, which will make our market cap to GDP sustainable.
Right.
If
And
we're
in fact, it
talking
is the
about
domestic
investment
consumption that
sector,
actually gives us a hint of the times to come as well. And that's a very important factor. Sanchita, thank you so much for breaking it down so clearly for our viewers. I have last few minutes. I want to bring in closing comments from both of you. To Apurva there. Apurva, if you look at the ranking itself, now, India was not very low. India was always number 8 as early as, not as long back as the January of 2021. So post-budget, we saw that little jump over there and we were expecting it to happen as well. But compare that to, say, China, which was number 5 in 2010. And look at China now, number 2. Of course, the gap is huge, but, that's also telling us a story.
You're right. China is another big economy with 17,000 per capita GDP in PPP terms. Their market capitalization is ought to be, multiple times that our market capitalization is. So perhaps it's a reflective of the fact that in China, companies are growing a little bit faster than Indian corporations, and they're contributing more to their GDP, and their economy seems to be a little bit more corporatized than ours, explaining some of the higher market cap they see. But as I said, I think, and what other co-panelists also said is absolutely important, that we need to invest in the right companies, and banking capital needs to go there. So our debt ratio can go up for corporates from here on, but provided we give debt to good companies. That's
all right. Apurva and Sanchita, thank you so much for joining us. I'm sorry I'm out of time completely, but we promise to return on this later in the show as well. So that was FYI today. We covered 2 very important issues for you. One, the nasal vaccine game changer completely, and the other about the Indian stock market. So much potential over here. Leave you with that thought. Thanks for joining us.